The Scottish sporting hero, Sir Chris Hoy, has been praised for his courage and positivity in the face of his terminal prostate cancer diagnosis. The six-time Olympic cycling champion was told last September that he had 2 to 4 years left to live. Campaigners hope the 48-year-old's decision to go public could end up saving the lives of countless other men. Prostate cancer is the most common cancer in men, with around 3,400 cases diagnosed every year in Scotland. But symptoms are difficult to spot, and more than 1 in 3 men here are diagnosed too late for a cure. This evening, we were joined by the consultant urological surgeon, Professor Alan McNeill, who is a founding trustee of the charity Prostate Scotland, and the broadcaster and comedian Fred MacAulay, whose family has been heavily affected by prostate cancer. Alan, lots of praise for Sir Chris Hoy, really bravely sharing his diagnosis, his terminal prostate cancer diagnosis. What effect do you think his actions could have on raising awareness of the disease?
Well, I would hope a very positive impact, particularly given that he's a fit young man who presumably had no symptoms until he presented with quite advanced prostate cancer, as he shared at the weekend. And I noted in the newspaper that his father and grandfather had suffered from the disease as well. And if anything, positive can come out of this for other people, it would be to raise awareness about this familial risk that is associated with prostate cancer, and which can often be symptomless.
Yeah, and Fred, you do your bit to raise awareness. Before we talk about your connection to the disease, you know, Chris coming out and talking like this is going to make a difference, isn't it?
I would think so, and I think what Chris has done in the last 48 hours will probably have a bigger impact than anything people like myself have done over the last few years. I think it's phenomenal what he's done, and as the Professor said there, the fact that he's a fit, and probably as fit a man as you would find, and young, by my reckoning certainly, young man has come out and said that he's got terminal prostate cancer, surely will waken people up to, you know, get themselves checked out. Yeah,
because it's had a big impact in your family.
It has, yeah. I mean, as you know, Rona, my dad was diagnosed with prostate cancer in his mid to late 60s. My elder brother is living with prostate cancer. He was diagnosed younger than me. And again, as the Professor will know, if you look online, any man that's watching this, if you look online and there's a few simple questions that will determine whether you're likely to catch prostate cancer. One of the things that it says is, does your father or brother have or has had prostate cancer? And that, you know, increases the chances that you're going to get it as well.
So, Alan, in what circumstances can men get screened on the NHS? Is it as simple as walking into your GP and asking for a test?
Well, there is no national screening programme for population screening in the UK, and that's on the basis that many men who, if we did screen anybody from 55 to 74, many of those men would have a low-risk prostate cancer that may never trouble them, and there's a risk of overtreatment, there's a risk of harm through the investigations. So at present, we don't have a test that is good enough to allow us to have a population screening program. There are plans for a study using MRI in screening, but this study will probably take 15 to 20 years to deliver a result. So at the moment, I think the best advice for anybody who has a family history of prostate cancer, like Fred, is to go and talk to your doctor, inform them about that family history, and ask them to test you and assess you for your risk, because there's no question there is a genetic element to this. And in the absence of a formal screening program for the whole population, we can at least encourage those at high risk to come forward and seek help and advice.
And presumably that's what you've done, Fred. Were you given one on the NHS?
Well, yes, initially I got a PSA test done because of the family history, but what I have done, and it's something that somebody in my privileged position can do, is I get an MRI scan done, and previously it was every 2 years. I now get it annually just to see if there's any change in the shape or the size of the prostate. So far, so good. But one of the things I wanted to say was that hopefully Sir Chris, who, you know, as a brilliant cyclist, and we knew that a lot of money went into cycling and we developed great cyclists because of that, maybe the same will happen with prostate cancer research, and maybe more money will come in and they'll be able to fund something, and as Alan said there, find some way to do a screening test for all men.
Yeah, I mean, what do you think about that, Alan? Just more investment to find a more effective test?
I think absolutely there's room for further research. I've been involved with research over the last 20 years trying to develop a method for assessing the prostate through mechanical palpation, and we continue to try and develop that. There is a critical need for some test in between PSA and MRI, because MRI is limited in its capacity by the scanners and radiologists to report them. And it would be fantastic if we had something in between the PSA and the MRI scan that allowed us to reassure those men who don't have a significant prostate cancer and fast track those most likely to have a significant prostate cancer. And then we could certainly see screening. Until then, I think we have to get this message out there about the familial risk and going along 5 to 10 years before your first degree relative was diagnosed. And in Europe, you need to be 5 to 10 years younger than they were,
right,
and talk to their doctor about the risk.
Because early diagnosis is so crucial, isn't it?
It really is. I was going to say particularly in prostate cancer, but I guess there's other cancers that are just as equally devastating. But the earlier you catch it, the better your chances of survival.
Yeah, because in Scotland, is there not more cases of later stage diagnosis, Alan?
Well, there was some evidence from Prostate Cancer UK suggesting that a greater proportion of men presented with advanced disease in Scotland. It's not quite as bad as it was represented. Scotland is similar to the other regions in the UK. The South East and London do best in terms of earlier diagnosis, but there's always room for improvement. I've been involved with Prostate Scotland for 18 years now, and we set out with a mission to try and raise awareness. And yet every week in my clinic and multidisciplinary team meeting, there will be a 52-year-old or a 55-year-old. And I just think, well, we haven't done enough. We need to keep getting this message out.
Hopefully Sir Chris Hoy can really make an impact here. We'll have to leave it there. But Alan and Fred, thank you so much for joining us this evening.